guys, welcome to yet another training video. Today I'm going to teach you guys how to do a proper consultation and also how to do deep tissue and use deeper pressure on the client and trigger point therapy. All right, thank you. Okay, so first things first, always look at the chart and just get like a quick reference of what the client's personal issues are. For example, this client today, Becky, she says that she's got sinus problems. You all have a sinus bag available to you in all of your rooms, on all your tables. So, when you come in, do like a, a little check. If the scent is a little faint, just add a little bit more eucalyptus or peppermint to it. You should be doing this for everyone because being face down for so long, everybody gets congested, as we all know. So you're going to put, 1 or 2 drops, give it a little mush, put it in, okay? Then come over to your client. All right, do you mind tucking your arms underneath the sheet for me? Thank you. And put the bolster underneath her feet. Now what this does is it takes pressure off of the lower back when you're face down. While you're doing your compressions, you ask the client, is there anywhere you'd like me to focus? Is there anywhere you'd like me to focus today, Becky?
Just my upper back.
Okay. And that pretty much is how you do a proper consultation, just to get an idea. You're going to palpate, obviously, later, in your muscle, in the client's muscles, and, you'll be able to see, where else you may find some tension in the lower back. Now, I'm going to show you guys how to do trigger point therapy and how to use proper deep tissue. One of the most important things about doing deep tissue work is the placement of the table. Now, the table should be, when you put your arm down and make a fist, it should be to the end of your fingertips. If it's higher than that, you're not really going to be able to use your body weight in order to get deep within the muscle. That is the secret of being able to put adequate pressure on the client. Some people are more handsy, as I like to say, when doing deep tissue. I find it more difficult to use proper pressure, especially for deep tissue work, constantly leaning on my hands, my fingers, and my palms, okay? You don't really want to do that. I use forearm and elbow and use that. That's how I have the stamina to do 5, 6 massages a day, day after day after day after day. If you're constantly putting that pressure on your palms and your fingers, you're going to have a very short career. So if we wanted to apply deep pressure on Becky, we're going to lean in, forearm. Now, you're going to have to practice. Obviously, this gets better with time, and you'll have more practice, but always make sure you're in between. This is where I call like the Goldilocks zone, like, just right, okay? So here is Becky's spine. Here is her scapula. Now, you want to stay in between, so you are in the Goldilocks zone in your forearm and down and through. How do you know you're using proper pressure on your client? When you're pressing down, you're feeling the muscle tissue, and just when you start to feel things to move around in there. We all know most people have a lot of knots, so when you start to feel them moving around and you're getting into the muscle tissue, that is always my good starting point. Then, at some point during the massage, I ask the person, how is the pressure? You don't ask, do you like the pressure? You don't ask a yes or no question. You always say, how? I want an answer from her. So somebody will say, oh, it's good. Obviously, it's fun. How's the pressure? If they say, oh, you know what? You can go a little harder. Obviously, you know to go from there. Now, trigger point therapy. Now, Becky had mentioned to us earlier, you heard her, that she wants us to focus on the upper body. She has a lot of knots for us to choose from. So at this point, I usually ask the client, is there anywhere in particular or where do you feel the most pain when doing a trigger point therapy? I also forgot to mention some useful information also with trigger points. Obviously, what is a knot? I get asked this question all the time from my clients. What is it? Now, technically, there is no definitive answer or study on what exactly is a trigger point. What is a knot? My personal feeling from doing this for a little over 10 years, it's a buildup of lactic acid that crystallizes within the muscle. So I usually describe a knot to a client as like a little marble that has sharp edges in it, and it pokes the muscle and causes pain when you push on it. There are two types of knots, passive and active knots. A passive knot is a knot that's somewhere in the body that the client doesn't know it's there, it doesn't bother them, and they're going on living their lives just fine with that knot there. For the most part, knots, especially passive ones, are not really going to affect the client or their health too much unless it becomes an active knot. An active knot is a knot that sits on muscle tissue or a nerve. Now, when that happens, that knot can cause, for example, sciatica, radiating pain, a pinched nerve, numbness, tingling, burning sensation. Most common, I hear people, they say it's like a stabbing pain in the muscle. So we tend to work on the active knots rather than the passive knots. Common place that you'll find passive knots are in the calves. Leave them alone. It's extremely painful to work on those calf muscles and those knots that are in the calves. So unless a client specifically asks you to, I just leave it alone. So now we're going to do a little trigger point therapy. Okay, we have found our knot right here. How does that feel, Becky, when I'm...
It doesn't hurt.
Okay.
But I definitely feel it.
Okay. All right, so now on a pain scale of 1 to 10, I usually advise the client, do not go past a pain level of 7. That is their level 7, not yours. So 10 being, let's say she's about to punch me, and 1 being she doesn't feel anything at all. Always tell your client to let you know when they're going past a level 7. I don't find it's really not necessary to work past that and have, your client, screaming in pain. Unless they want that kind of thing, but hey, whatever. We aim to please. So now we're going to work on this knot. Now there's 2 ways that I work on knots. One is cross fiber friction. The muscle fibers are going up and down here. So now we want to go across, and we are physically breaking up that knot, which, as you remember, it was a buildup of lactic acid that crystallizes in the muscle. So let's say it's this marble with sharp edges. Every time we go like this and back and forth, exactly as the treatment implies, cross. So up and down, right and left, up and down, right and left. Now you can do this back and forth, up and down, and sometimes you're gonna get, the knot will break up like that. Now a client may ask you other questions. Where does it go when we break it up? Well, knots for the most part are located towards lymph nodes. There are 2 lymph nodes in the armpits over here. Now when we break them up, they're gonna go through the lymphatic system, your bloodstream, so on and so forth, and they will be eliminated from the body over time. So through sweat, when you go to the bathroom, so on and so forth. You get the picture. So this is how we get rid of them. So you got cross fiber friction, back and forth. Never, this is very important, never dig into your client let's say for like more than, I don't know, tops like 2 or 3 minutes, any more than that, and you're like digging in there, the client is going to get bruising, swelling. They're going to be very sore the next day. We don't necessarily want that. We want them to come back and not, consider this like the house of pain. So, we're going to work on it, and we want results. So communicate with your client. This is the time where it's okay to speak with your client. Tell them, listen, let me know if you're going past a pain level of 7. Let me know when you had enough. It's okay to communicate, and sometimes men more than women will kind of hold it in. So you're also going to have to like pay attention to your client's body language. When somebody has had too much pain, you can feel them holding their breath. They're going to tighten. Pay attention to your client's body language. They're going to tense up. They're going to be like, that's when you're going too much. Back it off a little bit. It doesn't all have to be done in one session. Second way I do is using your body's natural pain response to release the muscle fiber. You can use your fingers and thumbs this way. I don't like to because it hurts, so I use an elbow. Now, you're also going to communicate with your client. All right, now, Becky, let me know when you feel like I'm like right in the middle.
Okay.
Right here?
No, a little back. Yep, there you go.
Okay. You have to communicate with your client, especially like, if they have many knots, there's too many to choose from. So now this is when we also take them to a pain level 7. You're going to go right in the middle of the trigger point and you're going to lean in and press down. Now let me know when you feel you're at a pain level 7.
Right there.
Okay. Going to hold for about 25 to 30 seconds. You can count to yourself silently. And that's when the muscle releases after 25 to 30 seconds. Once you've counted to 25, then you ask your client, let me know when you feel the pain subside and you just more feel the pressure of me pressing down on the trigger point, not necessarily like a stabbing or pinching pain.
Yeah, it went away.
Okay. So now you do that and then you smooth it through. I usually follow an action like that with a stripping motion to kind of move the knot and get it to move. Now, I usually do this process 2 to 3 times. When you go back on that trigger point, once again, ask your client, let me know when you're at a pain level 7.
Okay.
All right, hold for 30 seconds. And then Becky, just let me know when you feel the pressure of me pressing down on you.
Now I do.
Okay. And then run it through. Now, the third time around, hopefully, you're gonna, when you advise your client, and you could also mix this with a cross fiber friction, breaking it up. Okay, now hopefully this third time around, the pain is not going to be as sharp. How's that? Oh, that's a big one. Okay.
There you go.
There you go. Okay. So you can, do the, the trigger point therapy again at this time, or hopefully if the knot is not as stubborn and the muscle has released, you'll be able to, they'll tell you, oh no, it's not as sharp, the pain has lessened, or hopefully not even there at all. Then you've done your job correctly. Now, after, let's say I've done trigger point therapy on this side and the other side of the body. That's when I have another decision to make here. Now, I could do one of 2 things. If I have really dug into Becky and you know, I'm not going to want to put heat on her upper body. Heat, as we all know, increases inflammation. Now, if you were just digging into somebody, going back and forth and using your elbow, there's a good chance in a little while there could possibly be inflammation. So that's when you use the BioFreeze, the cooling agent. This is going to prevent inflammation. It's got a natural inflammatory in it, and you know, it's a cooling. So you would put this on. No heat. So now when you want to do your heating pad or anything, you're going to skip that. Do not put heating pad on the client. Now, let's say you didn't do trigger point therapy and you feel there isn't inflammation going on and you want to put moist heat on her. Now you can combine either the BioFreeze and bring the sheet up, and then you're gonna put the hot compress on the area. Also communicate with your client. Becky, if you feel like this is too hot, you let me know and I'll take it off.
Okay.
Now, this is another reason why we do the back first. It's usually good to do, you know, to have moist heat on somebody for a good 20 to 25 minutes. When we massage the legs, you have a good 20 minutes, more like 15. Okay, so 15 minutes, it's better than nothing. So then you move on to the legs and you let that kind of sit and do its thing. If you don't want to use the BioFreeze, I also like Tiger Balm. It's less intense as the BioFreeze as far as the cooling agent goes. But it's a natural pain reliever, and this also works very well, very complementary with the thermal heat. Now concludes our lesson on deep tissue and trigger point therapy. If you have any questions and you want me to show you more in depth, please approach me. I'm happy to help. Never be intimidated to ask any questions. I'm always happy to teach. This is the point when your client has, you know, you've concluded the massage and you come back in, you're like, okay, when I leave the room, you could get up and get dressed. And then I'd like for you to open up the door so I know I could come back in and go over today's session with you. So now you've gone back into the room, your client is ready and open to hear your notes. Keep it brief but thorough. Becky, as you may know, I definitely understand, you know, your pain. I felt exactly what you were talking about. You do have a lot of tension in your upper shoulders, your traps, also here in your neck, your levator scapula. What I suggest to you is to stretch out the area once every 2 hours. Some stretches for you that I would recommend would be to bring your arms back behind you,
Okay.
and push them back, chest out. Do you feel that stretch?
Yeah.
And hold that for 30 seconds. And then I want you to reverse it, round out your back, and stretch your arms out almost like you'd want to touch the wall next to you. That, and I also, for your neck, I would suggest that you grab your arm, bring your head to the right, hold that for 30, and then do the reverse. If you do that on a regular basis and do it once every 2 hours, my suggestion would be to put a reminder on your phone to kind of go off so you know to do this. If you do this on a regular basis, it's going to help you, as in, one, it's going to help you maintain all the work that we've done in between your massages, and two, it's free and you can live your life without pain. However, I would like for you to come back and see me in a month and work on this again. And please see Mariah at the front desk, and she's gonna offer you a special price to come back and see us. Thank you.